Welcome back to your Pelvic Health Podcast. This is Susan Winograd. I am the owner and founder of Pelvicor Rehab and Lead Wellness, and I am thrilled to be your host today. I'm really excited about today's podcast. It is a topic that is way overdue with your Pelvic Health Podcast, and something I think that needs to be a more universal conversation. Today, we're going to be talking about cultural sensitivity with sex and religion with my very, very special guest, Rivki Chudnoff. Rivki is a pelvic floor physical therapist in New Jersey, and we have been communicating, collaborating, and fostering a beautiful friendship from the moment we met, and I absolutely adore her, respect her, refer to her. Rivki, welcome to your Pelvic Health Podcast.
Susan, thank you so much for having me. What an honor to be able to get to do this with you. So thank you.
Yeah, I'm super excited about this, Rivki. I can't wait to have this important conversation and really want to thank you for putting this topic on the table. So I'm really excited to hear about all the amazing work that you're doing. Rivki, can you tell our listeners a little bit about yourself and what your background is?
Sure. I became a physical therapist back in what my children like to call the 1900s. It's great when they do that, right? It makes you
Yeah,
feel awesome.
yeah. Well, I want to say that my son went somewhere and he's like, went to a friend's house and he said, yeah, his parents were really old. They were like 50. And I was like,
They're not young like you, Susan.
yeah, I'm like, I turned 50 last week. And he's like, oh, okay, they weren't that old. Never mind.
Happy birthday.
Thank you. Thank you.
Happy birthday. Many healthy returns.
Thank you. I'm
Yeah.
proud to be
So
50.
yeah, it's a real privilege. Um, so so right. And when I went into physical therapy, I went in with the intention of working with children with disabilities. That's why I chose the profession, because I had worked, in high school as a volunteer and in many different camps for kids with special needs, and I really wanted to work with that population. That was really my passion, and I, was debating different fields, what to go into, and I ended up became a physical therapist with that in mind. And really pretty much, all throughout my coursework was just focusing on like, no, but I really just want to be a pediatric physical therapist, which I did. And I loved it, really loved it. And I worked in I worked in early intervention. I worked in a rehabilitation hospital for children and every imaginable school and kind of situation, nursery school. It was wonderful. And I married a gynecologist. That's what happened. I married a gynecologist, and he, somewhere along our procreation of creating our children, giving birth to our children, he's like, there's this field in physical therapy. It was really just an emerging field. Like when I went to PT school, I don't know about you, there was no mention of pelvic health. I took an elective, and I went to a good school, but I took an elective in women's health, which pretty much addressed like domestic violence, which is a super important topic,
Yeah.
but there are many other topics we could be talking about in addition to those kinds of topics. It was really, this whole field was really in its beginning stages, and it really wasn't being taught at the professional level as it is today. And I hadn't heard of it even, and I was like, that it sounds really weird. But I was like, and so, but the idea grew on me, and as I say often, I met Tali Rosenbaum, who is a sex therapist and used to be a pelvic health physical therapist at a conference when I was with my husband. And she told me about what she did as a pelvic health physical therapist. And at this point, I had already, had my own personal encounters with my pelvic floor, I think I had delivered like 3 children at this point. So I was kind of feeling her I was understanding her at a different level than maybe I did when I was 20.
It was becoming personal.
It was personal, yeah. And I was like, but it was really the work she was doing was really inspiring. And I decided to take coursework, to start my coursework in pelvic health. And at some point I was doing both pediatrics and pelvic health. And now I am, I would say 100% pelvic health for the last, met several, over a decade now. I mean, I've been a pelvic health therapist for, longer than that, but I was doing both for a while. And now I still do on occasion get opportunities to work with people and children with developmental disabilities in the realm of pelvic health, which is really great when I get to do that. But so that's where, this started for
That's
me. And
amazing. And I
yeah,
just want to mention something that you kind of glossed over, Rivki, that most gynecologists don't even, I mean, they don't show as much interest in pelvic floor physical therapy as your husband did. So I don't even know him. I've never met him, but I think he deserves a little bit of a shout out and credit for recognizing that this is a very, very much needed, you know, help for his patient population. But how lucky for you that your purpose and your mission, the vehicle for that was your partner in life. I think that's beautiful.
yeah, it really was. And it was, he was at Montefiore Medical Center and Jacobi. He did his residency and fellowship there. So it was somewhere along that training that they had a pelvic health program there. So he knew about it, and he was seeing that patients were doing great, that his patients, and he also does surgery, he does a lot of gynecological surgery. So he really was really happy with his, that patients were getting better. And so every institution that he's been in since then, he's really been a huge proponent of bringing pelvic health where it wasn't there and developing it. So,
That's amazing.
yes, he gets more than a little shout out for
Yeah,
that.
that
So,
is amazing.
yeah,
I wish there were more doctors like him who not only saw the value in it, but really advocated for their clients to have pelvic floor therapy, because we know how impactful we could be. So now that
absolutely.
you've transitioned, and it's funny, as you were telling your story, I was like, wow, we really have like similar journeys. I've been a therapist for, I'm coming on 29 years. I had no
Crazy.
education in pelvic health and PT school. I don't even think we had an elective, quite honestly. And I, went into every field. I did peds for 5 years. I did orthopedics for a couple of years until a door opened for pelvic health. And once I was in, I was drinking the Kool-Aid and I never stopped. It really, really changed my life. What's your favorite thing about pelvic health, Rifki?
I think that patients, um, coming in so often, as I'm sure you see in your office, they come in, oftentimes they feel like they're the only person in the world who has this problem, particularly in religious circles. And we'll get into that a little bit more
Yeah.
later. But oftentimes there's a tremendous amount of shame. They feel like everybody else, can have sex. Everybody else cannot pee on themselves when they laugh or go to the gym. Myriad of question, kind of, and oftentimes they feel like they're just never going to get better. And this is really just their life, and they're just going to have to live with this forever. And there's just kind of the sadness, and hopelessness that sometimes patients bring with them to the office. And sometimes they look at you and they just say, this is my last, like, nobody knows what to do, this is my
Yeah.
last whatever. So being able to offer them something that is not only like, I always tell patients, like, I'm not here to fix you, I'm not here to solve your problem, I'm here to help
To
you
empower
help
them.
yourself.
Yeah.
Yeah, I'm here to help you help yourself, and being able to empower them with information, because I feel like so much, they just don't understand what's going on. No one has taken the time to be able to explain to them what's going on. And as physical therapists, we often, and other pelvic health rehabilitation specialists, we're blessed with more than a 5-minute patient session. Like most medical professionals get like 5 minutes with patients. We
Yeah.
get, we're blessed with, I have 45-minute sessions, over an hour evaluations, to really hear their story, be able to educate them. And I think that they get 50% better by just understanding what's going on
Yeah.
and what it is that we could do to help them. And I think it's that leap of hope of patients just feeling like there's something that can be done to help them. And it's not some magic, and it's not some potion, but it's something that they hold within themselves.
Yeah.
I said, I'm here to guide you, and I'm here to teach you and to coach you,
Yeah.
but and to, support you and guide you through your journey to meet your goals, whatever they may be.
Yeah.
And I think it's that partnership, and taking people from a place of hopelessness to a place of, really feeling empowered and, hopefully getting better, right? That's the
Yeah.
goal. That really, to me, and changing their lives, really, being able to impact their lives in such personal and intimate ways, that really change oftentimes the course of their lives,
Yeah, I
as we
couldn't
know.
agree more. Sometimes I feel very dramatic when I say I really help change people's lives every day. but we really truly do help change people's lives every day, because people are coming to us with such a vulnerable issue where it's really in any circle really often not talked about. And you said so many things that I would love to address. And the first thing is, as you mentioned, we are very often the first person that makes them feel heard. And we both know that there's evidence-based research that shows when people understand what's going on in their body, that is one of the most important steps in healing. And I think that we offer that to clients in a way that other healthcare providers cannot. So when clients used to leave my office from an assessment and walk out the door and feel like 10 bricks were lifted off their shoulders and say, oh my gosh, I feel so much better already. And I remember I used to think to myself, well, we didn't even start yet. We haven't done anything yet. To me, transitioning and realizing that we've just done the most important part, which is listening to them, explaining their anatomy to them, making them realize that this problem is their issue is common but not normal, certainly not unique to them. You know, everybody's special, but those kind of problems are not special to them. So many people have them. But also you mentioned about what we do for them, and a lot of times it's basic education about sex. I am sometimes very surprised at how little people, both men and women, know about the dynamics of intimacy and intercourse and you know what the whole process is. And I almost feel like I'm doing that session in sixth grade where, you know, you have someone finally talking to you about sex. And I've had, you know, women in their 40s and 50s like crawling across the table and saying, oh my God, are you serious? Why didn't anybody ever tell me that?
Right? Why did anyone ever tell me that?
Yeah,
right?
so we really do get to do so many, I think, fun and amazing things to help empower people physically, emotionally, mentally, and psychologically, truly. Right.
Absolutely.
So I want to get to this topic, Rivki. How did this course that you developed evolve? What was the inspiration? What did you see in your clinical practice to make you say that this has got to be something that is offered to therapists to bring back to their practices?
Yeah, that's a good question. So along the way, I started teaching for Herman Wallace Pelvic Institute, teaching their pelvic floor one, you know, their series, their course of pelvic floor education for healthcare providers, PTs, OTs, PAs, nurse practitioners, some MDs even. And so I've been teaching for them for, you know, several years now. And they actually approached me, and Holly Tanner and Steve Prince over at Herman and Wallace. I really have to give them credit. They said to me, like, you know, we would really like to do a course on, you know, they have a lot of wonderful courses on lots of different
Yeah.
populations and specialties and, well, you know, all kinds of courses. And they said, you know, we'd really like to have a course on like treating patients who come from conservative religious backgrounds. Would you be willing to teach it? Would you be able to write this course for us? And of course I was just like, yes. So, and then afterwards I'm like,
What did I
oh
just
no,
do?
what did I just agree to? But you know, it was a process. And I think that it's interesting because I think that coming from, clinicians, right, who don't have a background in religion, they're not themselves religious, and they don't have, or they, you know, maybe don't have a lot of knowledge of other cultures. When those kinds of clinicians, you know, with those kinds of backgrounds get patients who come in their waiting room and they're like in religious garment, whether they're Muslim or Hindu or Orthodox Jewish or anything, you know, and thousands of other religions that exist in the world, and, you know, in the United States. And there's kind of this kind of hesitation, like, oh no, not what? Like,
Right.
you know, it's like, can I say this? Like, can I ask them to take that off? Like, and I think that there are two problems that they're confounded with. either they are undertreating, or they're scared. Either they're undertreating and they're like tiptoeing around the patient, which I think is more often the case. They don't realize that they can say that, they can ask that, it's okay. Because they just want to be respectful. Like, I think as healthcare providers, we go into this profession because we want to help people, right? The first law is like, do no harm, right?
Yeah.
We don't want to hurt anyone's feelings. We don't want to offend anyone. We're super sensitive, I think, an empathetic group in general. And we don't want to say the wrong thing but so sometimes in the attempt to be too sensitive, they don't get to the meat and the potatoes. Like, you got to
Yes.
talk to them about what's going on in their vagina, what's going on
Yes.
with their erection, what's happening, and getting those questions. And so they're kind of nervous. Or you get clinicians who, which I think is less common, who perhaps, the way in which they do deal with the patients are like, well, why don't you just masturbate or whatever it is? And it's like, you don't understand, for these people, people of religious origin who are, I'm using masturbation as an example because it's a very loaded topic in a lot of religions, where
Right.
they literally, it's it's for them, it's a law that they take very seriously, for men to be, that should not be masturbating. And that's in many different religions. And many times that is a prescribed, what would be helpful for them if they would masturbate. And so if you have a clinician, I'm just using as an example, who says, well, you should just need to masturbate more often and you won't have this problem, it's kind of like, they're not going to do it. They're going
Right.
to smile and they're going to look at you and be like, mm-hmm,
Right.
mm-hmm. So I think that on the one hand, having the knowledge, and listen, every person, there was a great quote um, from the Jewish Matchmaker show, from where she said there are like 5 billion Orthodox, either 5 billion Jews in the world, I'm loosely quoting her, something like 5 billion Jews in the world, which means that there are 5 billion different ways to be Jewish, or whatever the question, whatever the number was,
Yeah, I would say
and
that's the case in any religion. Like, there's
right,
people, like, I
exactly,
think we have to understand that with any religion, it's always a spectrum. And
correct,
people
absolutely,
fall on so many different points on the spectrum. And I would even go so far as to say that no two people are at the same exact point on the spectrum. So we really have to, just understand that if we're not coming from a religious lens, and really understand that each person that is coming from that spectrum also has to be treated uniquely and individualized and not lumped into a specific religious
correct.
category.
100%. And even that same person, I would even say, even that same person is not existing on the same point of the spectrum as maybe they did 6 months ago or a year ago or 10
Great
years ago.
point.
So people are constantly evolving in themselves as people, and as spirituality is being part of that, and religious life. So absolutely, I couldn't agree more, is that, you know, that quote, there are, millions of ways to practice Islam, millions of ways to practice Christianity. And so really getting to understand the patient as an individual and what's important to them is important. But it's, they're like, well, I just had a patient who was Hindu last week and she was cool with this. Like, I understand why you're not. Like, understanding that these may be the rules, but having a baseline of understanding of what does it mean? Why do they wear that?
Right.
What are the general rules, that pertain to physical exam, or any idea of physical that falls within the realm of medicine and beliefs in terms of religion. So we could be sensitive and understanding the general rules, and then having that as our framework. And then when we do the patient interview, speaking to the patient and just saying, is there anything, about your religion that you'd like me to know? Or is, just kind of asking the curious questions.
Right. So
So, are there any laws that
yeah.
pertain to sex that you would like me to know about, or whatever it is, and that you follow?
Right.
So, or what have you been taught about sex, or how? And I'm using sex as a question, but it can, be
It
all kinds of different
could
issues.
be intimacy, right? So what you kind of touched on this a little bit, but what I would love to hear from two perspectives. What tips can you give therapists to improve their cultural or, sensitivity to people with conservative religious backgrounds? Like, for example, everything I do, I come from a curious lens and I ask a lot of questions. Everything is permission based. So would it be okay if we talked about this? If there's
Absolutely.
anything that you do not feel comfortable talking about, please tell me. you're in charge. So I always put
Right.
the empowerment over to the client. Everything I do is
Right.
permission based. I frame everything in terms of a question, not like, can you tell me the last time you masturbated? I would never say
Right.
that. I would say, is it okay for us to talk about the practice of masturbation and see how they
Right.
respond to that? So I would love to hear how you help clients navigate that, but also how to help patients, clients, people seeking help. How can they improve their own language as they approach a healthcare provider, specifically a pelvic health physical therapist?
Yeah, that's such a good question. Yeah, that's wonderful that you're doing that. I wish every therapist was using that kind of language, using, we don't just need consent to touch, but even to talk and ask the question,
Yes.
is it all right if we talk about, you know, I feel like it's also that way, with family members also, like, do you mind if we talk a little bit about what happened last night when you came in at 11 o'clock?
Yeah.
Like, it's always good in all of our relationships to be
It's so true. And it's interesting that you say that. My husband will probably kill me for saying this, but when I need to speak to my husband about something, sensitive, or like something that I think he may get upset about, I'll say, is it okay if we talk about something important?
Yeah.
And then it
Yeah.
sort of gives him a second to prepare and internalize, like, okay, we're going to talk about something that I may need to rein in my patience for. But I think it gives the person a second to mentally prepare that you may be asking them a thoughtful question.
Yeah, no,
Yeah.
we're setting them up in the right way. And I think, when you have patients who might say, actually, I don't really feel comfortable talking about that today, then we know that that's, either, maybe they want to revisit it later or maybe they don't. But, and explaining to them why it would be helpful for me to know if you're comfortable, because explaining to them why it is that we're asking, let's say, poor masturbation is getting, getting
Yeah.
used a lot of this. But, it's important for me to talk about, I would like to hear about X, Y, and Z, because it helps me, it's kind of when patients come to me for like bowel and bladder issues,
Right.
or we ask them about sexual function if it's relevant.
Absolutely.
Bowel and bladder, we explain to them, we take out our little pelvic model and we say, well, like, here are the muscles and here are all the organs, and this is why I'm going to ask questions about how your poop is, because I know you can
Right.
do for pelvic pain, because all of these muscles, are related, and whatever our spiel is. So
Yeah.
explaining some why it is that it would be important for me to know this,
Yeah, or how
right.
graphic they want you to be. Like, I have had couples come into my office and I'm literally teaching them how to get into different positions for sex. So, and I've had
The fun day at the
people,
office.
yeah, it's a fun
Things you
day at
didn't
the
expect,
office.
Susan, 20 years ago. Susan, is that what you thought you'd be doing with your physical
Um,
therapy license?
I don't know if I thought I would be doing it 20 years ago, but I will tell you, I never thought I'd be doing it the way I'm doing it now. Now, like, nothing's off the table with me. Like, you want to learn something, just come my way. I'm happy to
That's
teach it to
right.
you. But,
That's right.
I've had people with,
You're doing a huge thing for them.
yeah, I've had people with very conservative religious backgrounds in my office be extremely open to wanting to learn different positions and how to please their partner and how to have sexual appreciation for themselves and their partner, and foreplay, and what the best way is to have foreplay, and how much time they each need for foreplay. And then I've had people that I was shocked were less conservative, and they're like, I'm not comfortable with that. And I think,
Isn't that amazing?
yeah,
It really, like that old cliche, you can't judge a book by its
you
cover, is
truly
always
You
fascinating to me,
truly
right?
cannot. Yeah, sometimes we put stereotypes on people, not even religion, but with age. I've had people in their mid 80s coming to me and say, you know what? I can't orgasm anymore, or I'm not enjoying it as much when my husband performs oral sex on me. Like, what can we do about that? And I'm like, you're the coolest person in the world.
I want to be when I'm
Yeah,
80.
you're my new role. You're my new role model. So
Right.
you're so right. You cannot judge a book by its cover. So people coming to a therapist, how would you guide them and give them the language to get the help that they need, but also make them feel comfortable?
Right. So from a therapist perspective, I get phone calls a lot, people, they're like, I think this would be a good question for you, Rivki, because they know I personally myself am a
Oh boy.
practicing Orthodox Jew. So um, they will ask me questions. And I think like what you said about being curious, on the one hand, we want to be curious. On the other hand, we don't want to be reliant on our patients for education,
That's
whether we're
right.
talking about patients whose sexual identity or practices are different than our own or what we're used to, or whether we're talking about people whose cultural or religious beliefs are different than our own. While we want to ask questions about that individual, we want to do our own homework as clinicians and
Yeah.
get ourselves as educated as we can before we get into that room with that patient, if it's possible.
That's a
So take my
great
course,
point. Yeah,
but
Rifki, that's a really
but
great
getting
point.
educated, because patients, oftentimes will say to me, I couldn't believe they didn't even ever hear of, whatever, whatever the practice is, they were kind of like, you would have thought somebody who's been doing it for as long as they have heard of that before. So I think not relying on our patients for educating us about religions or practices or sexual preferences and what that entails, and also knowing how to, like you said before, couch the questions in ways that are helpful and really build an alliance with our patients, practicing
Yeah.
cultural humility, not assuming because I saw a movie on Netflix once, I understand everything about your culture
Oh,
now.
really?
Like, you
I watched that. I
know,
watched that series on
you see
Netflix.
that one, right?
I don't know it all now.
Yeah, exactly.
I
So
feel
I
like now
think
you know less than you knew
you
before
did
you watched
before,
it
right?
because probably 85% of the information is not accurate.
Or maybe it's accurate for 10% of the population,
Correct.
whether they're that religion or something else. So, learning to practice cultural sensitivity, which I think is important, regardless of what background somebody comes from, and asking questions that are respectful, like you said, and using language like, would it be okay if I, use the word, penis, vagina? What do you like to call your genitals, or whatever that may be? So, there's that. And then and from the patient's, perspective, I think, finding clinicians who are, it's hard to know. It's like, you want somebody who is professionally trained and
Yeah.
experienced in pelvic health, because like I like to tell patients, like,
I'm so sorry. Do you hear what's
please,
going on around me?
no,
There's
I
like
think you're good.
crazy drilling, and I feel
I
like
don't hear it at all,
you don't hear
actually.
it. Okay. Because
No, I
this,
think you're good. It's
yeah.
just annoying for you. Yeah.
Yeah, no, I just feel bad. The listeners, I'm apologizing in advance. Um, yeah,
I actually don't hear it at all, so maybe they
okay.
won't hear it
Yeah,
either.
I hope so. Well, if you guys do, I'm sorry. Rifki, as you're talking, I didn't even think about this before we were anticipating recording the podcast, but I think that not only should all pelvic health therapists take your course, but psychotherapists. I have so many people from conservative religious backgrounds who need psychotherapy, with regards to intimacy and sex. So maybe they need a sex therapist or a regular psychotherapist who needs to address intimacy issues. And I get some feedback sometimes. They're like, they didn't understand my religious norms. So it really was a big waste of time because they were giving me advice and not understanding, that there were just things that were off the table and some things that we could not do. So I think what you are doing is so important and goes way beyond the field of pelvic health physical therapy.
Yeah, you know what, I'm certainly not, I didn't invent the field of cultural sensitivity in the medical profession or the mental health professional. There certainly are, people whose work, whose research that I used, in articles to put together this course. But I certainly think that it's an important thing to be able to um, meet people where they are and have some kind of basis of understanding of where
Yeah.
they're coming from. And also to understand that, and this is something else I speak about a little bit in my course, is the concept, and this exists not just in religious communities, in faith-based communities, but I think that even in the general public, depending on how people are raised and the culture they're raised in, this is something that I've really discovered, a significant amount of sexual shame that comes along with the package, whether it's more in people who come from faith-based communities where talk of sex or education was limited, or it was not necessarily a sex positive type of atmosphere that they're growing up in, whether that attitude was intrinsic to the religion or whether that's just the way the messaging came across to them. Because what I've discovered in my research is that, in working on this topic, is there are many religions where perhaps the religion itself is what we would call sex positive. Like, there's nothing necessarily bad about sex, but it's just the delivery of it, or the lack of information, or the lack of education, or messages that get passed along that get packaged as religion, but have nothing actually to do with the law or the spirit of the law, actually. So and there are religions who actually sex is, there's a lot of guilt and shame that is intrinsic to it. And this exists, not just in religious populations, because many people and colleagues I've spoken to who did not grow up in religious backgrounds also carry a tremendous amount of sexual shame as well. Tina Shermer Sellers, who I had an opportunity to speak to in the development of the course, who wrote a book on sexual shame and religion. She's a psychotherapist. Did a tremendous, there are others who've done tremendous work in this area. But I think knowing that how our patients feel about, let's assume we're talking about a patient who is having issues that pertain to their sexuality or sex, understanding that they may be coming in with preconceived notions about what this means for them to be a sexual being, what pleasure means to them, what how their body feels to them. How many times have you had patients who come in and they don't want to look at their vulva? They don't want to see their vulva in the mirror. They've never seen their vulva. It's icky, it's disgusting, it's gross, it's dirty.
And that's not a religious thing.
Fluids. No, absolutely not. But you will see that oftentimes with patients who come from all points of the spectrum, but I think particularly patients who haven't had good education. And I think that oftentimes people who have been educated in secular, public schools, while I'm sure many people will complain that they could be doing a better job, they are getting oftentimes more, or were getting more of an education than I think in some of the religious schools, where whether, depending on, pick your religion, if people are being educated and they're getting their sex education from school, that oftentimes, or from wherever they're getting educated from, whether it's the family, oftentimes they're not getting education, or they're not getting enough education, or and I do think that there has been strides being made in a lot of faith-based communities, understanding that we really have a problem, and that we're teaching girls about menstruation, we're talking to boys about, I don't know what, getting pubic hair, when maybe we talk about the mechanics of intercourse at some point, or maybe we don't. But the whole conversation about sexuality and what that means, and when we talk about sexual development, arousal, and that people are going into sexual relationships in adulthood or teenage years without this kind of basic information, creates a lot of problems. And I do think that a lot of faith-based communities have been doing in the last 10, 15 years. I've seen a difference in my practice. When I started over 20 years ago, the amount of misinformation and lack of education that patients were coming in with was much more severe than what I'm seeing now. I think there's been a real effort in the last 10, 15 years, and I see it in the patients who come into my office. It's coming through, whether it's premarital counseling, we're talking about people who are not sexually active, or maybe even if they are before marriage, from a faith-based community. It has been efforts, and there has been a real change, and we're still working on it.
Absolutely.
But when patients come in with a lack of education, there's a fear of what's going on with their bodies. There's a discomfort oftentimes. And sometimes I see patients who come from the most religious subcultures of society, and I'm amazed. They come in for urinary incontinence from their 10th baby or whatever it is. And, and I'm amazed and delighted by their ability to like talk about sexual, ask them questions about,
Yes.
sexual function, and their ability to be so comfortable about, their bodies and sex and orgasm. And there's some people who've been like in the prearranged marriages, they met their husband or their partner twice before. And I'm flabbergasted by how wonderful and healthy their relationship is and they're with themselves and with their partner in
Right.
terms of their sexuality. And I say to them, how is it that you have developed such a wonderful, comfortable relationship with your body and sex, coming from such an austere kind of community, religious community, where they don't have media, they don't have internet, and she just kind of looked at me. She's just like, from my family, from my mom, from my, we just kind of talked about things, and my sisters or whatever it was, and her parents spoke to her mother spoke to her, whatever it was. So I think that as parents, there's a lot we could be doing to
Yeah.
help, mitigate, giving our kids, whether not just being reliant on school or whatever educators they'll be getting later in life, but it starts from day one when we raise them and how we address them with their bodies. And that's a whole other conversation another time,
Yes.
but
Yes. No
about
nicknames,
that. But it
right?
does make a difference. What's that,
No
say again?
nicknames for body parts.
Right,
You know,
right,
like
right. My
I
kids are so appreciative of that. Yeah,
Yes, and
they're
I
like
I think that's I know nicknames. I honestly have never asked my kids if they're appreciative, but I am very proud that we've never had nicknames for body parts. But I think the point that you made is so important, Rifki, is that we cannot rely on educational institutions like our schools to educate our children on sex and intimacy, because the truth is they may be giving accurate information, but it might not be conveyed in the way that our children will internalize in the right way. So I think it's our responsibility as parents, if we are parents, to continue that conversation, to instill a sense of being comfortable in your own sexual skin to our children, and that talking about it, you might not, perhaps this is not a conversation that they will have with their friends at the dinner table, but it certainly should
I
be a,
warned them about that. I'm
yeah,
like, so not all parents are going to be cool with you,
yeah.
like educating their kids. So like, I'm happy for you to ask me any question you want, but like, let's just keep this
Yeah.
here.
Let's keep it in the Chudnoff house. I remember one Saturday afternoon, I had like 5 books out in front of me on the couch. I think one was a penis book, one was the vagina Bible, one was like a menopause book. And my son just
Yeah.
casually said to me, he's like, Mom, my friends are all coming over. You mind putting those books like to the side or something? And that was like, I'm like, oh, I've done a good job. I have penis, vagina books out. And he's just like, you know what, Mom, maybe my friends don't want to see that.
Totally.
But
Totally.
believe me, we have books all over the house with all kind of body parts on it. But we have to keep that dialogue open about sex, intimacy, masturbation, pornography. Like, we cannot rely on other people. And I think the more we infuse that into our children, the healthier they will be as an adults.
Yes. And that's what you're seeing, oftentimes in the office is, when there is a lack of education, people are suffering from not understanding healthy sexual boundaries. And that's another conversation for another time, and
Yeah.
sexual safety, both in a marriage, in a committed relationship, or in the world.
Yeah.
Because that was never explained to them either,
Yeah.
that their body is their own and they have a right to say no. And
Yeah.
whether that is with a spouse, whether that is with a person they met at a bar, or whether it's a person who they passed on the subway. Um, and
Or their high school
and
sweetheart, no matter what.
correct,
Yeah.
correct. And so I think that, education is really, key in all communities. So in terms of what you asked before, which was patients when they're looking for a provider, I think it's important, that they have a therapist who's seasoned enough and has the skills, which I think is the baseline, and that they've not just taken like one pelvic floor course one time, which I think is great, but that's a
Yeah.
good starting part. But also, speak to interviewing the therapist and say, have you ever, treated somebody who comes from XYZ community? And even if that therapist maybe didn't, but sometimes you can speak to a therapist and get the idea of like what their attitude is, like how are
Yeah,
they are
it's a
they open, are
relationship.
they,
You have
yes,
to, you have to connect. And I always tell people, call a few different people, whether it's a psychotherapist, or you have to connect with them on a certain level. And you're right. I think we all need that education, But I think there also has to be that feeling of safety, because if they don't have that feeling of safety, there's not going to be any kind of resolution physically or emotionally.
Yeah,
So I think that's so
100%.
important. Yeah. What are the biggest challenges you see in your practice treating people from very conservative religious backgrounds?
That's a good question.
Or maybe you don't have challenges because
Yeah, no,
you
no,
are
no, no.
really,
I'm trying to think what
you're
is
meeting people where they're at, which I guess is the
right.
bottom line. And, having the language that makes them feel safe, whether they do want to talk about it or they don't want to talk about it, whether they do want to undress or take off, their religious clothing, or they don't. And, giving them the message, there is so much that we could do within the context of your comfort zone.
Yeah.
So, it's
And
never all or nothing.
100%. I think, not making assumptions, not making assumptions about what's been going on or what hasn't been going on. I think that I'm always challenging myself not to assume that I see a patient and I think I know what I'm looking at, because there's always time when you're surprised, or I'm sure you have the experience,
Yeah.
you think you had it all figured out, and they're like, oh, but I haven't quite
Right.
figured it, taken that into the picture, is not making assumptions, and being able to kind of really see each person as an individual, perhaps in the context of their culture or their religion or their background. But like you said earlier, being curious and also asking patients what their goals are and not assuming what their goals are.
Yes.
So, like I've heard you say in previous podcasts, is that patients' goals are really what drive our sessions, and that we think we know what it is this patient is coming in for, but maybe that's not. Like, the fact that X, Y, and Z is happening is much more important to them than ABC. But to me, I personally would have been much more bothered by X, Y, Z. But you want ABC is your priority. I always tell
Yeah.
patients, like, we can get to all these things, but not all in one day. So what
Right.
is the most important thing for you today? What
Right.
is it that you want to, you will feel like you got what you wanted out of the session and out of this, therapy. So really listening to our patients, listening to what they're telling us,
Right. And
which I
I
think is
think
true of
that,
all patients.
yes, and I think that is such a brilliant point, because I'm sure you've heard me say this on my podcast before, but when a client comes in, we go over their goals verbally, articulately, because what they put on their intake form very often is different than what they're telling you in person for many different reasons. Maybe they don't want to put that pen to paper about that topic. Maybe when they were filling out the intake form, that's not what was on the top of the mind before. Maybe they were thinking about urinary incontinence, or they were, had some pain with sex, but when they came in, they're like, you know what, I haven't been able to orgasm in 10 years. That's kind of important too. So I think that conversation in the beginning, and really chatting with the patient and having them, ascertain what their goals are. And I always tell my clients, I want you to think about what your goals are. And I say this all the time, because once you tell me what your goals are, I'm going to be a fierce defender of your goal, because I'm going to want to make it happen. So that conversation is so important. You're so right.
And and I think what you said about, patients, that speaks to their feeling of safety with you. Like, for example, the patient who comes in with urinary incontinence, that they come in, and when you start asking questions about, let's just say, painful sex, because you're just trying to get an idea of what's going on, with the pelvic floor muscles, and, and and they kind of, like, they feel safe, like, this is the person I could talk to.
Yeah.
I thought I came in because it bothers me that every time I pee, every time I do jumping jacks, I pee in the gym, and it's really embarrassing. Yeah, it is. And I also do want to deal with that, but like you said, I haven't been able to orgasm, or since my last baby, it's been really wonky down there, and I'm having pain. And you're like, I have, Susan, she seems like a cool person, and someone I could trust with this very intimate part of myself. And what, actually, that would be great. If we could talk about that too, and you could help me with that. Like, I didn't even know you could do that. I didn't even
Yeah.
know that there was help with that. So, kind of, and patients change, goals change, being flexible, be like, I
Absolutely.
thought this was what I thought, they asked, this was the most important thing to me, but actually, I think this is really more
Yeah,
important
and
to me
I
right
think
now.
that really conveys a feeling of safety. I think that shows that there's safety. You know what? I thought I was coming to you for this, but I'm kind of switching gears. It's all about that therapeutic alliance and feeling of
100%.
safety to be able to say whatever you want. And one thing that I do, and I'm curious, I'm assuming that you'd be in line with this, but if it's something that you tell other therapists to do, and which is when I do have somebody that comes to me from a conservative religious background, I always say, I'm a physical therapist. I am approaching you as respectfully as possible, but I'm not coming to you from a religious lens. So I would never tell you to do anything that goes against your religion. If I convey a message that you think may be doing that inadvertently, I apologize in advance. Please continue to communicate with me. I don't know everything, and I have that humility about it. I always want to learn, but if there's something that you're not comfortable with, if there's something that I'm telling you to do that's not in line with your religion, please tell me, but also consult with your local religious leader, right?
Yeah, 100%. And I think, in terms of advice, like we touched on something so important is that speaking to patients is that that patients should, I feel like sometimes patients, depending on their personality or, their upbringing, when they come to medical professional, they just smile and go, uh-huh,
Yeah.
uh-huh. But, ask the questions. Don't be afraid to ask the questions of, sometimes I'll say to patients, I'm like, I've had 2 cups of coffee right now, so I'm just gonna be like,
Yeah.
so please stop me if something I said doesn't make sense.
Yeah.
Or if you have a question, because sometimes they're just kind of receptive and passive, please stop me, please ask me. Everything is up for discussion. Please
Yeah.
ask me a question. Please let me know if something, whether this is a religious patient or a patient who doesn't come from any particular religious background, if something wasn't clear, or if something, doesn't sit right with you, or if you didn't understand something, or if there's something else you want to tell me about.
Right.
Please let me know and ask. So I'd really encourage patients to ask the questions, to
Right.
not be afraid to ask the questions, to challenge the therapist,
Right.
to let them know. Because if it's any therapist who's worth their degree, they will be open and listening,
Yeah.
and really grateful
Yeah.
that you've expressed what it is that's going on internally. Because I always say patients, like, even if you have a patient, who's having pain during a session, it's like, if you don't tell me, listen, some patients are very, they're being like,
Yeah.
hopefully we don't get that too much. And
Yeah.
then you have patients who are grinning, like grin and bear it kind of people who, like, they're just like, no, I'm
Yes.
fine. It's good. No, it is
Yeah.
good.
Keep
Like,
going.
you
Keep
need to
going.
tell me. You
Yeah.
need to tell me, because I can't feel what's
Yeah.
in your body. I
Yes.
don't know how that feels to you. So you need to let me know if this is more than just a little uncomfortable or a little stretch. You need to let me know. So whether that's a physical discomfort or an emotional or spiritual discomfort, to really communicate that to your therapist, because we don't want you walking out of the room with pain or embarrassment of any kind
Yes.
that you didn't let us know when it was going on.
Yeah.
Because once you've left, there's nothing we could do about that. But in the session, it's a two-way relationship in terms of trust. Please let me know if there's something I could be doing to make you more comfortable. Do you need 2 pillows under your head? Do you
Yeah.
want the room lights on, lights off? All these small things, but also
Yes.
larger things. So,
You know,
all of that
and I
really helps to build that relationship.
Yeah, and I think, we've been therapists for quite a while, but I think we also become very masterful at reading people's body languages. And I'm not just talking about this during the physical exam. I've gotten really, really comfortable to, be sitting across from a patient or a client, and I can tell by the look on their face that something's not sitting well with them, or they're uncomfortable, or there's something that they think that they should talk about, but they're not sure. And I will, very gently say, I'm getting the sense that there's something that might be on your mind. Please, I invite you to share. I really invite you to share anything that you feel comfortable with. And really, sometimes the patient wants to, but you need to give them that invitation or open the door for
Permission,
them.
right?
So that permission. So, read their body. We have to read each other's body languages. And I always tell my clients, please be transparent with me. If I'm giving off a vibe that you don't like, tell me. Rivki, I could talk about this with you for days and days and days. And I think the work you're doing is so beyond incredibly important for everybody. And I'm going to say again, that goes way beyond pelvic floor physical therapy. Can you share a takeaway that you'd like our listeners to leave with?
Absolutely. Just one thing that you did speak
Yeah.
about, and I just want to give credence to that, is speaking to religious leaders is that if you have a patient who is from a religious background, making, and if they do have a religious leader or authority who they follow, asking the patient's permission to bring that person into the treatment team or into the conversation can oftentimes be very liberating for patients because they have not asked the questions. And oftentimes there's much more room within their religion than they realize there is. And if they feel like they need to be in alliance with certain religious beliefs, really being comfortable as therapists to kind of realize that this is important to this patient, and that oftentimes is really freeing for the patient to know that you're in alliance with.
That's so true.
I always joke that
it
I
takes
didn't
the
realize
pressure
that,
off them.
Yeah. So I didn't realize that half my career would be spent talking to religious leaders about sex.
That is hysterical. I think that is so important. And, I think I always tell my clients, I am willing to collaborate with anybody that's willing to talk to me. So I think that's such an important thing that you just said, because very often when it comes to religious norms, they might not feel comfortable talking to a spiritual leader about sex and intimacy and masturbation, but we do. So I think that's really brilliant. Give us a pearl of wisdom, Rivki, that you'd like to leave us with.
Yeah, there's, without oversimplifying or globalizing, making everybody the same, because we know that everybody's different. There's a great line from The Muppets Take Manhattan. I don't know if you see that movie, where
which movie?
says,
I didn't hear what you said.
The Muppets Take Manhattan.
Oh no, I didn't see that.
Okay, so it's a movie from my childhood. Now I'm really dating myself. Where the chef says to Kermit the Frog, "Frog, peoples are peoples." And I think, well, we're not all the same, and there are nuances and there are differences, and we need to, really not pretend like we know everything about everyone or assume they're like us. Mm-hmm. But understanding that underneath the garb, underneath the austere appearances, or perhaps awkward body language or awkward social things that seem like awkward social norms to us, they're just people.
Yeah,
and
we're all so much more similar than we are different.
So much more similar than alike, and we need to respect each other's differences and be curious about those differences and respectful, but understand that under it all, we all, oftentimes have a lot of the same needs and wants and problems, unfortunately. And I think kind of when we approach our patients with that kind of an open heart, they feel it, right? They feel us, they feel our sincerity and our love for them as well. And that's just creates a wonderful relationship for healing.
Rivki, you're amazing. You're amazing. I don't even remember how we met, but I'm so happy we did. And I'm so grateful to be able to collaborate with you, and so grateful for our friendship. We've done courses together, and one of these days when you come to Florida, we're going to hang out. You need to come.
Don't tempt me. You're on.
I have amazing guest accommodations. Rivki,
you don't have to convince me. You said Florida.
We'll have a girls' night out. Rivki,
let's do it.
I know people are going to want to find more of you. We're going to have it in our show notes, but tell us real quick where everybody could find you.
So my either it's on Instagram at Rivki Chudnoff PT, or my practice name is called Hamakom Physical Therapy, but it's probably easier to say it or you can email me. But
we're gonna have
right now. That's hard to remember that. But anyway,
we're gonna have everything in the show notes.
Susan, thank you so much for having me. This is such a wonderful venue for patients and clinicians to get information, and I certainly love listening to. I always learn something new when I listen to your podcast. So thank you for doing this.
Rivki.
This is a lot of work. Thank you so much for what you do.
My pleasure. Thank you so much for joining us on today's episode of Your Pelvic Health Podcast, where we give you the real lowdown on all pelvic health matters. If you enjoyed this show, please like, follow, and don't forget to leave us a 5-star review, because we want to continue to bring you the information that you want to hear. If you found this episode helpful, please share and tag us. We'd love to hear from you. And always remember that healing requires a whole body approach, and you need to be your own best advocate.